guys, my name is Dr. Igor Chaplik, and today we're going to be discussing earlobes and earlobe repairs. So what are some of the common reasons that patients come in for their earlobe? Sometimes an earlobe can tear as a result of trauma. Usually it's because there's an earring in place, or particularly with hoop earrings, sometimes they can get caught, unfortunately. Another reason patients come in is sometimes there's gauges involved and the earlobe gets really stretched. And when the patient removes the gauge and wants it out, the earlobe is left in that position. And so what we do sometimes is we correct it. And it's a simple in-office procedure. Sometimes a patient comes in if they still have an intact ear and an intact hole, but it's stretched over the years, whether it's from heavy earring use or just basically getting older. And sometimes the patient really wants that hole to be smaller so that it can hold an earring. And so we can offer a couple of different procedures to do that, whether we repair the earlobe, and I actually offer something brand new that I want to talk to you guys about in a later video. So how do we repair the earlobe? How do we address these issues? Really, it depends on what the issue is. A lot of times with gauges, what has to be done is the areas, it's usually an in-office procedure. It's very quick and simple, very painless for the patient. They go home the same day. They come back in 10 days and take the stitches out. But basically, depending on the size of the hole is how we treat it. So if it's a gauge, then what we have to do is numb up the area. We have to remove skin around the gauge and under it, and then do our best to align the skin so that when it heals, it's not visible. And that's always the goal of an earlobe repair, is to do it so that there's no trace and no one can really see that anything's been done. And you have to, and I have to, pay meticulous attention to the lining up of the earlobe so that when it heals, there's no visible step off or deformity, and so that actually at the end of it all, when the patient comes in for her follow-up photography, nothing is seen, and that's the ideal goal. And for those of you who are just not into in-office procedures or any kind of numbing or any kind of cutting, I am now providing a brand new treatment approach, which just involves basically applying a liquid to the ear that kind of peels the ear and then tightens it as well. So depending on the size of the defect, I can now provide earlobe repairs without cutting, suturing, or anesthesia. It's a simple 2-minute procedure actually, and I have excellent results with it, and I'm really looking forward to providing it to my patients in the